Hi, my name's Nathan Everding. I'm from Syracuse Orthopedic Specialists. I am a surgeon in the group. I specialize in hand, elbow, wrist, and shoulder surgery. I take care of patients of all ages, mainly with upper extremity problems. I actually grew up in Central New York. I grew up in Skaneateles and completed high school here in Central New York before leaving for undergraduate in Providence, Rhode Island, and then medical school in the Bronx. So I think my main treatment philosophy focuses on seeing every patient and every problem as an individual. Oftentimes diagnoses can be the same between patients, but patients' lifestyle, age, activity level plays a significant role in what treatment options may be and whether or not to proceed with certain options. I think the other thing that's really important about my treatment philosophy is that I do think patient decision making is very important, and giving the patient all of the proper information about their problem or their diagnosis, about the different treatment options, and about what they can expect is really important to help them make a decision on treatment, more so than myself making a decision. It's guiding them through the process to help make the right decision and right treatment for that particular patient. So I think I first became interested in being a doctor or becoming a surgeon in elementary school, actually. During science, I really liked science, and I thought, how can I do science and also still be involved with people at the same time? And I thought that would be being a doctor, and I stuck with that for a long time, with many thoughts of being a different type of doctor. In medical school is when I got drawn to orthopedics. I was really heavily considering being a surgeon, and then I had a chance to assist on some orthopedic surgeries and realized that this was what was really exciting and a special field and something that was really suited to my talents and my interests, and that's what really brought me into being an orthopedic surgeon. So that came along, I think, shortly after that time, as I was visiting different programs to kind of figure out where I would be doing the rest of my training. I spent some time with a hand surgeon, and I really loved it. I thought that the hand was an incredibly interesting and probably the most powerful tool we have, and all orthopedic surgeons like tools. We're basically carpenters for the human body, and being a high-volume shoulder replacement surgeon is something somewhat unique to our area. It's a field that's growing very rapidly. We've made some advancements in shoulder surgery over the past decade, which have allowed us to treat patients that we couldn't treat before. And I think that is an important service that I can provide to our area. And the type of surgery and the type of medical practice that we have is really a quality of life type of medicine. And so instead of dealing with somebody that has a heart or a lung problem that can cause a real medical issue and even facing things such as death, in orthopedics we're really trying to help people with their quality of life. And so we take people that are functioning or functioning at a lower level and help to bring them back to a level of function, or get them back involved in sports or exercise, or just help to relieve daily pain and allow them to lead a more happy life. And I think we get to see a lot of people that we can help and make them feel happy and pain-free again, and it's very rewarding when you're successful at that. Well, I have 3 young children, so I spend a lot of time with my kids outside of orthopedics, which is probably what I like to do most. And they're getting now to the ages where we can do a little bit more in terms of sports and outdoor activities. So we're over the past couple of years we've been learning how to ski with them, playing sports, soccer, t-ball, softball, hopefully get them involved in lacrosse soon as well. So I have a lot of fun with my kids and my family, and I think that family time is what I look forward to most when I'm not working. I think SOS is a phenomenal group, and it's a great family. We have been able to build a very large practice, and by doing that, we have really made ourselves orthopedic specialists. We have somebody for just about every specialty in orthopedics, and sometimes more than one person. So we're able to really deliver expert level care to patients with any need that they have. Sometimes it may seem a bit daunting to the patient to see so many surgeons in one group, or have to see multiple surgeons for each of your complaints. But really, the way medicine has evolved, we've learned how to become experts in so many different areas that it's hard for one person to be an expert in all of them. And by putting together this group of experts, we're able to really give high-level care to any need that somebody may have in orthopedics. It takes a lot of effort to stay on top of it, and I think that's always a concern of mine. I want to make sure that I'm there for my family and my children, and I think I can always do better at the balance, and I'm always constantly trying to figure out what's the best way to balance this. And it takes a lot of time and effort to be a surgeon and be a good surgeon and be a good doctor, and I don't ever want to sacrifice that, nor do I want to sacrifice my time with my family and my children, and being a good father and being available to them as well as my patients.